be able to get up every morning and say, yeah, I like my job, I like what I'm doing, I feel like I'm adding value, that I'm making a difference. Push it in there, you'll notice that the meter will come on.
Bill Frizzell is part of today's generation of hospital and health system pharmacists who are making a difference in revolutionary new ways and in very new places. In the surgical intensive care unit of a large Veterans Administration hospital, as part of the management team at a newly founded community-based hospital in the Midwest, in the pulmonary unit, and in the neonatal intensive care unit at a large urban hospital, and in the emergency and pulmonary departments at a teaching hospital. Despite the differences in the settings where they work, they share important similarities and are part of a trend that has brought pharmacists into roles that were almost unimaginable not too long ago.
We're up on the floors, working side by side with the nurses and the physicians, taking care of patients, either rounding with the physicians, reviewing charts, consulting with nurses, and actually in the patient's room, educating them about their medications. Even in the 13 years that I've been practicing in the hospital, the level of service has increased tremendously.
It's actually a collaborative effort, and everyone's main interest is just the patient, making sure that his disease state is properly managed.
Observers inside and outside of hospitals and health systems say that the role of pharmacists will only continue to grow.
We were looking at the past 20 years to now, and it definitely went from a dispensing role to a clinical role, and more of an interdisciplinary role. So I can even imagine what it's going to be in another 20 years.
As far as for CD4,
my career's in management, where you're overseeing those clinical pharmacists on the floors, working with physicians, and just bringing that to the next level. I think our impact is going to be heard pretty loud very soon.
It is their value as medication experts that is driving the demand for hospital and health system pharmacists in a variety of settings. In staff positions, advising on medication selection, administration, and dosing. In administrative positions, managing and coordinating the pharmacy staff. And as part of clinical teams, providing direct patient care.
I work mostly in the areas of neonatology and obstetrics, and in neonatology, the patient population is a very tiny patient that requires a lot of specialty care in that field. We may have a baby that weighs 500 grams or a baby that weighs 5,000 grams in our NICU, and that could potentially cause a 10-fold change in dose depending on which baby I'm taking care of. So if that's the case, then I have to be very astute as to what we are prescribing and dispensing, and making sure not only is it the correct dose, but that the correct concentration, and that it can work well for that particular patient.
There's so many complex drug regimens that we're using to treat diseases that a few years ago there were no treatments for. So every day a physician or a nurse could come in contact with a drug regimen that they're not familiar with or don't know how to administer. So by being outside of the pharmacy, right there on the patient care unit, we can provide that type of drug information.
As the demand grows, more and more pharmacists are choosing to practice in hospital and health system settings, drawn by the job satisfaction that comes from assuming a leadership role within the medical team.
I get to work with great people. I work with pharmacists, I work with technicians that challenge me each day. I like to challenge them as well. What's the next opportunity that we have to advance the profession?
am I going to be fulfilled in the job that I go to every day, in the career that I see myself in? Am I going to grow? Am I going to use the education that I've been putting all this time and effort into? And I think that means more in the long term than, you know what, this year I made this much money and I was able to get this car, buy this house. It's, you know what, I can go to work tomorrow and be happy and excited and challenged and know that the day is not going to be the same. It's always going to be different, and there are going to be different challenges.
Hospital and health system pharmacists also say that their interaction with patients contributes to their job satisfaction.
I think that I see myself as a patient champion. I really try and look at every patient as if it were my mother or my best friend and what is best for them. So I look at cost of the medication. That may be really important to the patient, and it may not be something that the physician necessarily thinks about in the hospital. I know that if we start them on a really expensive medication, that they may not be able to afford it. I look at their whole picture, so all the medications that they're on, to make sure that there are no drug interactions or something that may make the patient feel excessively sleepy or excessively excited or shaking, or side effects that they experience from drugs. And so I try to go in and really talk to every patient about their medication that they're on to make sure that we have them on the right regimen for them.
When I see somebody and I figure out that they're suffering from a drug interaction and they're complaining of nausea and blurry vision, and I recognize that, I put into action a plan to fix that. And those patients then come back to me and say, "Oh my gosh, I feel so much better. You really made a difference in my life."
If you're just wearing shoes.
Making a difference in the lives of others makes all the difference in the lives and careers of hospital and health system pharmacists.
I love what I do. The job that I have is not just a job to me. It is something that I really am excited about when I get up in the morning and I get ready and come into work. I know that I'm going to make a difference in at least one person's life. The environment that I work in, the people that I work with, and the things that I get to do that make my job really interesting and fun is something that I just can't imagine not having in my life.
I love being a pharmacist. I wouldn't change anything.